Hi, my name is Rick Olderman. I'm a physical therapist and a anesthetics practitioner, and I want to talk to you about hip, knee, foot and ankle pain. What's going on here? Why are we having chronic pain in this area and we just can't seem to solve it? It's first important to understand that our bodies work as a series of systems. So an injury rarely occurs in isolation, and this will be important especially with the lower extremities. So it's important to understand that there's a lot of different types of lower extremity injuries. I mean, we have things like piriformis syndrome or plantar fasciitis bursitis, IT band friction syndrome, anterior knee pain, hip pain, or arthritic hips or knees or feet or ankles and things like that. But I just want to challenge you to start thinking about this not from the perspective of what do I do for plantar fasciitis or what do I do for bursitis, but I want you to think of this as a problem with your system of how everything is working together. And if you can fix that system, even if you have every single injury on this list, this is all due to a systemic issue. And you'll see what I'm talking about in just a second here. So one of the really important things that you need to understand is there's this idea of femoral anteversion and retroversion. Now those are really big scary names for a very simple idea. Here's the thigh bone, all right? It's called the femur, and that's where femoral comes from. Now, unfortunately, all of our thigh bones are not created equal. And so some people's thigh bones are rotated in which case it's called anteversion, and there's some people's thigh bones which are rotated out, which is called retroversion. Here's a couple pictures of it. So a person, you can see that this thigh bone is rotated in. And so at the knee, it's going to be rotated in a little bit, which causes, frankly, a lot of knee pain. And people with this problem will tend to have their knees knock knee together, or their feet will rotate in slightly, or things like that. With femoral retroversion, which means that the thigh bone is rotated outward, you can see that the knee joint is pointed outward now. These people will typically stand with their feet out, or need to stand with their feet out. So the reason that this is a big deal is that if you don't know what is going on with the shape of your thigh bone and you're not pointing your feet in the appropriate direction based on that knowledge, then you're creating a lot of stress to the hip, the back, frankly, the knee, the foot, and the ankle. And you'll figure that out in this program, what shape your thigh is in and what you should do about that. Now, another issue that's going on here are the butt muscles, the gluteals. And this group of muscles is so important, yet so underused and problematic. Most people I see with at least hip and knee pain have a poor gluteal function issue going on. And so the butt muscles, they extend the hip joint here, and they also rotate it out to the outside. But they also do a lot of other jobs too, and it's so important to get those working, especially when we're walking. If we're walking and our butt muscles aren't being used, then we start to develop tracking problems with the head of the femur or the head of the thigh bone in the hip socket. And this is called anterior femoral glide syndrome. And it's basically an improper tracking of this head of the hip bone. Well, what kind of problems does this cause? Well, it can cause labral tears, it can cause pain in the front of the hip, it can cause pain on the side of the hip, chronic bursitis or IT band issues. It can cause pain in the back of the hip, such as piriformis syndrome or other types of pain back here, or it can cause global hip pain. So this is a real big deal, and getting the gluteals to work well is a huge, huge deal in terms of fixing pain like this. All right, now the hip flexors are another big deal. There's three big ones that I'm talking about specifically, and they all start up here on the pelvic bone, and they all insert at the kneecap or below the knee, and the kneecap then inserts into the lower leg. So they all insert virtually below the knee joint, and they all have slightly different functions, but they are so important. If there is tension or if these are not working well, it wreaks havoc on the positioning of the pelvis and therefore how the hip joint is working, as well as how the knee is working and even the foot. So a very big deal. We'll go through how to test these and fix them too. Now, in terms of knee pain, it's important to understand that the knee is caught between the two giants of the hip and the foot. And so if there's a problem with how the hip is being controlled, as we talked about just a second ago with the gluteals, well, that feeds down to how the whole thigh bone is controlled, which then can stress the knee joint. And if the foot isn't acting well, well, then that can rotate this lower leg bone in and also affect the knee joint. So there's precious little in the knee that's actually controlling the knee, and usually most of the problems will be happening in the foot and the hip joint to fix knee issues. Now, having said that, there is one muscle called the popliteus, and few people seem to know about this. And this is the inside of the knee, and this is the outside. So the popliteus muscle has a broad origin on the inside lower leg bone, and it gets smaller and smaller and inserts on the upper outer knee. And I will tell you, I have helped so many people by releasing this muscle. It is just amazing what this does, because this muscle guards against knee hyperextension, and by that I mean it guards against knee locking. And if you lock your knee a lot, then you're going to really stress this muscle. And if the knee is rotating uncontrollably, for instance, if you have weak gluteals or your foot is flat, like we showed in the last picture, then it's going to stress this muscle, and this muscle can cause tons of knee problems. So I show you techniques to fix this as well. It's hugely powerful. All right, now let's look at the foot and ankle. I just have this image here because I want you to have an appreciation for the complexity of the foot and ankle. There's a lot going on here that needs to be addressed. And so when you get into the program and you get into your testing, I'm going to show you how to specifically test a few things that are big problems in the foot or ankle that many practitioners don't seem to test, but I get huge benefits for my clients with. One way you can easily tell whether you have a flat foot or a high arched foot is if you walk in some water and you walk on a piece of paper. Let's say you do that, or you walk on the sidewalk and your footprint looks like that. Well, that's a pretty normal foot, because there's a good amount of tissue contact with the ground, but not too much. Now, here's tissue contact with very little of the ground, so this would be a high arch person, because nothing of the arch is even close to touching the ground. And then here's what a footprint would look like with someone with a flat foot or a flat ankle. And so you get a lot of tissue contact here. And there are specific problems that occur because of each of these types of footprints. And I have taping techniques that I show to offset a lot of this stuff. Okay, so here's our picture of the lower leg muscles, and I just want to show you here that we have very large calf muscles and soleus muscles which cross the knee joint up here, and they extend down into the heel bone, and they can cause lots of problems in the foot and ankle if they are too tight. And I offer great recommendations for how to test this, but also how to fix this in the program. And deep to these are other muscles, and you'll notice that these guys extend all the way down into the bottom of the foot. So if we have problems up here, it can affect the foot, and if we have problems in the foot, it can affect problems all the way up here too. So it's good to look at the body like this. Now, the big reason why the calf and soleus is so important is that when we are walking, if our calf and soleus muscles are nice and lengthened, it allows the knee to pass over the foot easily while we're walking. And so very little stress is transmitted down into the foot because the ankle joint is moving easily. But if these are excessively tight and the knee is trying to pass over the foot, well, then it can't. And so where does that energy go? Well, that energy then is driven down into the foot and stresses the bottom of the foot and contributes to chronic plantar fasciitis, Morton's neuromas, and other things, other problems of the foot and ankle. So the calf and soleus is key to a lot of foot and ankle issues. Now I want to talk about this idea of fascia. And fascia is simply connective tissue. It connects muscles to muscles, muscles to bone. It holds blood vessels in place. It connects nerves to muscles, all sorts of things. It holds everything in place. It's the glue of our body. And fascia can occur in these superhighways in the body. For for instance, this can be dissected in the body as one contiguous piece of tissue because fascia is holding all of this whole system together. And this is why I just want to really challenge you to think of at least the lower body as a system that's working together, because look, this connection is so strong up here, and things in the foot so strongly influence things in the pelvis. And I'll just tell you a little story. I had a woman come see me because of plantar fasciitis, and we solved her plantar fasciitis by working with this system. And then when she got up to leave, she said, you know what, I've had a headache for 3 days and it's gone. And I believe it's because we addressed tension here, which fixed the whole system of tension that was going all the way up into the top of her head from this line of fascia in her body. Okay, so we must understand how these different systems work together, and that's kind of what this video is doing, is introducing you to the idea that the foot does influence the knee and the hip, and the hip does influence the knee and the foot. It goes both ways, and so we need to understand how these things are working. And so in this program, you'll be testing to figure out how yours is working, and then we'll fix each issue that isn't and fix your system. How we walk really creates strain to our systems. And again, I mentioned before, if the gluteals aren't working, well, then we get tracking problems in the hip joint. But there are other issues that happen at the knee, we mentioned briefly too, and it can even affect things that work at the foot, or down in the foot and ankle. So how we walk influences how that gluteal muscle gets turned on. And so we'll be working with changing your walk, actually, to start getting this whole system to work better. And it's very simple. So if you have chronic lower body pain, it's likely you're not broken. You just haven't been addressing these issues and looking at your body like this. And so that's what this program is all about, is helping you understand how things work together and fix those issues that aren't working together well. So what do we do next? Well, the first step in solving any problem is to first understand what's wrong, and that's what Lesson 2 and Lesson 3 is in this program. In Lesson 3, we're going to be testing a lot of different issues with your lower body, and so we're going to find out exactly what needs to be fixed. And you'll receive an individualized plan to address those issues that we find. And then we're going to fix it. And in Lesson 4, we start with stretching. And in Lesson 5, we have lots of taping techniques, which are hugely powerful, especially if you have foot, ankle, and even knee issues. I have a lot of taping techniques that are very simple to do, but very powerful in removing stress from these tissues and letting them heal. In Lesson 6, we address habits, and let's face it, how you're using your body has a lot to do with why you're having chronic pain. So we show you how to change that. And then we have more fixing. So in Lesson 7, we have strengthening. In Lesson 8, we have somatics. And somatics is just a very unique way of releasing tension in the body. And quite frankly, chronic pain or nagging pain or returning injuries are often due to excessive tension in the body. And so I teach you how to remove that excessive tension using somatics. In Lesson 9, we have some odds and ends recommendations that don't quite fit anywhere else. So these are kind of funky and fun, but frankly, in quite a few of my clients, these are the things that help them turn around. So you can look at these and see if they apply to you. In Lesson 10, you know, let's face it, with chronic pain, you need some hands-on work, many of you. And many of you won't. But for those who do, and practitioner help, I offer the hands-on techniques that I use here in my clinic that are hugely helpful for my clients. And you're going to take these videos to your licensed medical practitioner. They're going to do these with you, and you're going to feel tremendous relief with them. So that's what that whole lesson is about, is showing you those techniques. Now, final fixing happens in Lesson 11 with advanced somatics, and Lesson 12 with advanced strengthening. Because let's face it, the whole reason you're doing this is so that you can get about in the world and enjoy yourself again. We want you to enjoy exercising or time with your family or doing whatever it is that you love doing. And so the whole purpose is to identify and fix these issues that are stressing your system and causing this chronic issue. All right? So I want to thank you for taking the time to watch this video. I hope it gives you insight as to maybe what you've been missing in your life. And that's what this program is all about, is fixing your system and fixing you. So good luck. Thanks.